Great. I did want to thank you for attending this webinar on a Friday, busy season, end of the year. I just really appreciate your interest in the topic of program evaluation. I think I'll get started just to honor your time that you've come today. I am part of the North Central Region Aging Network, where Michigan State University is one of 12 states that have this network. And we're offering these professional development webinars both on aging topics, but also just general extension professional development topics. And I myself am a gerontologist and have formerly been a program evaluation specialist for 10 years with extension. So this is a perfect combination of topics for me, and I'm just very excited to share with you some information related to program evaluation designs that measure change. And we're going to be looking at examples that have health outcomes. My name is Cheryl Eschbach, and I am currently the acting director for health and nutrition programs for Michigan State University Extension. And as I mentioned, I previously was in a program evaluation specialist role statewide. So every content area, not just our health programs, but it's definitely my passion is measuring health outcomes given my background and previous experience within extension. So I will, I'll start the slide deck and get us started with today. And I have about 20 some slides, and then I figured we could just open it up for questions. So the overview is I want to expose you to the 3 most commonly used program evaluation designs that measure change. And then I'm going to talk about how we measure changes in attitudes, knowledge, skills, or other indicators important to the program. And I'm going to show you some examples of Michigan State University Extension program evaluations that utilize these different designs. So these are the 3. These are the 3 most common program evaluation designs used within extension programs. The first is one-time measurement. So after a series or an event, or even at the end of a year, of a program year, it's one time. And it's a single shot. The second type is pre and post measurement. So this includes 2 measurements taken across an event or a series. And the format can be either traditional or retrospective, and we'll talk about that. And then follow-up measurement, where you want to see if there's been maintained knowledge or action taken or practice change based on information you gave through your programs. So let's look at the common designs a little closer. The first one, that one time, it's also called one shot or single shot. There's variations of the name, and it's just that. It's one-time measurement at the end of the program. And there's a practical use for that type of measuring change, but it does have some limitations. Then there's the pre and post test, which creates an opportunity to collect 2 points in time, 2 measurements with the same audience that can be either completed retrospectively or in a traditional format. And both designs measure perspectives that are before a program and after a program. So after that educational intervention that's done, whatever information that's transferred. And typically the designs of pre and post measurement are self-reported data. So that's people telling us their own attitudes and self-reporting their own behaviors. Then the third common design are follow-up studies. These definitely take more time and resources, but they are great for monitoring and tracking people across time to see if they actually implemented the knowledge that we gave them. It gives people time to implement changes in their skills and behaviors. And a logic model can be really helpful to use in program planning to identify those outcomes you expect much later than just right after the event. So now I'm going to dig in. We've sort of done the overview of the 3 types. I'm going to really dig into these 3 designs and give you examples. So one-time measurement, again, the most simplest form of program evaluation, right? You measure an outcome right after an event happened. Tell us something you learned, what you're more aware of. Maybe we changed an attitude with information we presented. It's really helpful when you have program objectives, because if you've done your pre-work and you've written program objectives for that education you've delivered, you can ask directly if that's what they learned from that day or that event. So we usually will ask people to reply to questions with words like somewhat or greatly. You know, there are different variations of what they may have learned. These are all self-reported changes based on the information they were just given. And when you do a one-time measurement, you really want to be careful you understand your audience. What are the literacy levels of audience when you have your questions? What's the attention span? And then also that balance between how much education did you just provide and how long is that one-time measurement evaluation you do at the end of the program, right? A nice balance of, if you do an hour of education, you might only have 1 to 3 things that you ask them about, right? That balance. Designs for short-term outcomes, which would be immediately following a program, can typically measure an attitude change or even a knowledge gain. So this is an example from the extension program, Cooking for Crowds. Cooking for Crowds is a food safety program that we deliver in communities to community groups like churches and nonprofits that cook large-scale amounts of food for the public. And this survey is administered after participants go through a 1-day workshop on food safety. It's very straightforward, and it asks about intentions to change. So we ask, circle your response to how often you will practice this food safety technique based on the information you were taught in class. And you can see here the answers are categorical. They're not numeric, they're words. And to analyze this, we remove the people who said they did this before the program, because we didn't change them in that day. They were already doing this food safety practice. And then we get rid of the people that say I probably won't do, because they're not going to do it. And we combine together the people who either plan to do or plan to do more often. And once we combine those outcomes, we can take those 3 survey questions and come up with an impact report that looks something like this. 82% based on the Cooking for Crowds program will now limit the time food spends in the temperature danger zone. So the actual survey questions give us the bullets for the impact report. Nice and straightforward, really shows the value of a simple one-time measurement program evaluation, simple to collect, simple to report. Other designs for short-term outcomes, this is a variation on asking self-report. You might want to do an assessment of real knowledge, so like a test or an exam on the content that you taught in the workshop. This is a good idea if you want to give a certificate to course completion, or you need to know that they actually got the technical information correct. And in this case, this is an example from our Dining with Diabetes program, in which people can then report if they have. So when figuring those percentages, yeah, we only included the 2 middle options. We combined those together and then reported those are the people who intend to do it more often or plan to now do it. We could separate that and report both of those pieces if we want, but we tend to find stakeholders and others like it if you can further combine that and just call it intentions to change. They don't like too much nuanced information. So good question. So this was from the Dining with Diabetes, and we teach them about food and what to eat and what to do with their diet. So we ask in a multiple choice, like what's the correct answer? Designs for short-term outcomes can also include measuring changes in behaviors or practices. So sometimes a simple categorical response, which you can see here in the headers, which has a frequency of none to more than 3, can also have a numeric value, which is helpful for analyzing the data. And this is an example of an extension program that has an objective to get people to be more physically active. I'm sure you can relate to that. A lot of our extension programs have an element of that in food and nutrition. And here we are asking participants in a typical week, how often do you stretch or walk? And then we base that, because it's a behavior, on frequency. It's not an attitude about walking or stretching, but it's a behavioral question about how often do you do that. and it's self-reported. Take that with a grain of salt too. This is another example of one-time measurement for short-term outcomes. This is related to healthcare utilization or medical care. And this is a set of 3 questions that can be used to talk about the concept of medical care or health literacy. So participants will indicate their frequency of preparing questions for their doctor, discussing personal problems related to their illness, and communicating with healthcare providers is what we are trying to measure. And so you might have a set of questions that are getting at that concept that you want to measure. And this could be asked in a one-shot design at the end of the program, but you could also use this set of questions, just like the example we just saw with physical activity, in a pre and post measurement. So you could ask before and after a program, maybe it's over a series or a couple of weeks. And so that leads us to the value of having 2 points in time, a pre and a post measurement. And it's really useful to use pre and post measurement. I mean, some people even say this is the gold standard in program evaluation because we're trying to measure change based in between the intervention that we've provided. So a participant completes the self-assessment of the past before the education and then the current after the education. And they can rate a variety of rating scales. And what this gets us is a number changed. The number of people who moved from a 3 to a 4 or from a 5 to a 1, wherever that direction is in the survey that we want them to go based on the education. And it also creates an opportunity to talk about percent changed, because if you have the number changed and then you know how many were assessed, you can calculate a percent change for reporting purposes. And there are 2 types of pre and post measurement, and we're gonna talk more about that because you have choices in how to do this pre and post measurement. And I've seen it done both ways and they both work, but they have pros and cons. So the different formats, the traditional pre and post is collected at 2 points of time. It's like 2 paper surveys, 2 before and after, 2 collections, where usually there's a code provided to connect the pre and post. So people use variations of phone numbers or date of birth to match pre and post surveys or questionnaires. And then there's the retrospective type, where again, they're gonna, at the same time, one time on one sheet of paper, they will reflect what they knew before and what they know now. So let's look more at that. This is an example of a traditional pre and post test that we do for our chronic disease self-management program. The program is 6 weeks. And so at week 1 and at week 6, the participant fills out a set of surveys. And we are using a set of 3 different symptoms that can be reduced as a result of the education. It's on a visual scale of 0 to 10. This is actually an established scale about pain. The other ones include fatigue or shortness of breath. And so participants are asked at week 1 and then at week 6, how often these symptoms interfere with their daily lives. And we're able to take this information and calculate an individual change score. By taking the post, we subtract the pre rating, right? So if they were a 10, and now they're a 7, we create a change score that says whether they increased in the direction that we hope they did. And in this case, it's decreased symptoms. And then sometimes people have no change. They might be a 5 and they end the program at a 5. And we just didn't have any movement there. We use this information in reports like this. So for the chronic disease self-management program, the 3 different symptoms that are measured pre and post, we'll calculate a number changed. And then the number assessed in this case are the number of surveys that were returned. And even you'll notice that differs because we know sometimes people skip questions. So we use the number assessed to then create a percent change. And I know sometimes educators feel like 45% change isn't enough, but for behavioral change or really in a reduction of symptoms, something like this that's health focused, this is in an expected range and in a good range to talk about change. I mean, this is almost half are leaving with decreased symptoms. So let's talk a little more about the difference between using the traditional format and the retrospective format. because the sources of bias differ. And you'll want to know that when you're making the decision for your program. In a traditional format where a pretest is taken before the education begins and then after the education is completed, there can be what's called a response shift. And that's response shift bias. It's when people over or underestimate how much they really know before we teach them something, and then they adjust that. And so sometimes the change isn't really change, it's a bias. In a retrospective format, pre and post ratings are provided at the same time. And a bias here is motivational bias, because sometimes our participants know how we want them to answer that, right? You just spent the day with me, I'll be sure to show you that there was change. This can also sometimes be called effort adjustment. And it happens when participants want to present themselves in a better light or in the way that we think we're asking them to be measured. So advocates for the retrospective design actually claim that there's more honest self-assessment when you allow someone to think for themselves, what did you know before and what do you know now, in one survey collector. Here's an example of a retrospective pretest design that we use at MSU Extension for a program called Stress Less with Mindfulness. It is a series program. It's 5 lessons over several weeks. And this is from our social emotional programming. And you can see the 7 items are collected in the middle. These are the objectives of the program. Basically, can they identify 3 mindfulness tools to help them manage stress? And at first, participants can feel kind of overwhelmed by this chart. They see, why are you asking me the same question twice? But what we find is if we provide some instructions, and you'll see directions there for a paper copy, but also when we're administering the survey, we'll explain the format. We'll say, hey, you'll notice these are repeating. We'll ask you for 2 types. You know, what did you know before and what do you know now? And we find that once you sort of describe the format or the instructions, people give a pretty quick gut reaction on that rating scale. So there's a little bit of upfront explaining a retrospective, but once you can get participants used to recording that, you can get away with kind of asking a few different questions. Like on here, we have 7 different questions. And this again gets us 2 points of measurement that we can calculate change for individuals, and we can calculate means for program level effectiveness. So you get like 2 different analyses out of this type of measurement. This is another example of a retrospective design we use for an anger management series called RELAX, which is an acronym. And we have them think about before and after the series. And again, these survey items are the objectives of the program. So to yell and scream at others, there's a whole lesson that talks about that. And so we would expect some change here. Now, what I thought I would tell you today is that we used to use a traditional pre and post format for this program. And then we were finding people they were changing in the direction we didn't want them to. We wanted to see improved communication, but after we had some dialogue with participants, they said to us, you know, I really thought I was using good communication skills. So when you asked me before, I thought I don't do that. I'm respectful. And then as you taught me things in the series, I realized I could do this better. And so we saw a shift that their communication got worse at the end of the program, which again, to that response shift bias. So we went to a retrospective format, and maybe some of you who are familiar with parenting education program evaluations, that's also a common thing that you'll see is caregivers and parents, they think they know a lot more about the correct practice, and then you teach them, and then they kind of say, I didn't know what I didn't know. So this is the last example of the retrospective design, and I just mentioned it with the health outcome of self-efficacy. We have found this to be a very useful concept, both theoretically and in measurement, for several of our programs in Extension. Powerful tools for caregiver program, of which this example is from, but we also have it in the chronic disease self-management classes. Again, because we're trying to get people to increase their self-efficacy or their confidence to handle something, which we find we can change people's reality of that in a couple-week series. So, and to review why pre and post measurement often works the best, it's commonly accepted in program evaluations. It gives us those 2 points in time to measure. Survey questions can be tied directly to the goals or objectives of the program. So in a way, it's very straightforward, just like the one shot, but you're getting a second piece of information to compare people to themselves. And you can also do more multivariate analysis when you start to get into using sets of questions or concepts like self-efficacy. It allows the ability to test program effectiveness. We can look at demographics and see how demographics differ on outcomes, and which can contribute, I think, to scholarship and publishable results. So there's some good benefits to using pre and post measurement. The last common design that I want to talk about is to measure change involves follow-up and checking in on intermediate program outcomes. So like maintain knowledge or new skills or behaviors people do. And the follow-up time really depends on what your program intends to do, like the program dosage you had in the first place. And if you've had any refreshers or any continued contact with participants. So I've seen everything from 3 months, 6 months to a year for a follow-up at the end of a program. We also find it's really helpful if you tell people you're going to be following up with them. Otherwise, they will really ignore your follow-up evaluation. And using the same sets of questions from pre and post measurement can be helpful because you can repeat those to see if people maintain knowledge, or just asking again about their frequency of doing things to see if that's increased or decreased. In a follow-up study, you can ask about behavior change. You've given people some time to make changes in their environment or in their actions and behaviors. And measurement of behavior can be self-reported, which we typically do in a survey question, but it can also be direct observation, seeing someone in action or in their environment, or observations of others. So sometimes in the youth, we'll have parents report on youth behaviors. You know, another person who's close to the situation, they can see that. And some of our SNAP-Ed policy systems and environment change work also can include an observation component. And as I mentioned already, follow-up measurement can really occur in different increments. It's got to make sense to your program that you've implemented. It can be 6 months, it can be 12 months, it can even be years, really, if you've been in contact with people. And the decision really comes back to, do you know your audience? Are they expecting you to ask these questions? And you know, will you get that kind of follow-up information? In extension, we have a unique opportunity that sometimes we have repeat audiences. So something at Michigan State University that we've done is we have incorporated, when we have repeat audiences, say at an annual meeting or just a recurring group, that we use that as an opportunity to say, hey, last time we met, we reviewed this program or this information, tell me how you used that. And then we might end a program with, tell me what you need in the coming year or that coming time before we meet again, as like a needs assessment. And I know I've heard some feedback from people that, because you know, evaluation's tagged on, it's another extra thing. But if you can incorporate it into how you talk with participants and use the information, we have found pretty successful ways of doing that. And we collect multiple modes of contact information. So your traditional emails and phone numbers, but we might get even their place of business, or which school they're affiliated with, or what hospital they were referred from. It's about finding samples later for follow-up studies, actually. You know, keeping good program records makes it easier to do longer-term evaluation. And that's really, this is my last slide to sort of bring that all together. You know, designs for long-term outcomes, they do take a lot of investment of time and resources, but they can be very valuable. I feel like a lot of extension programs are getting pushed to show those longer-term outcomes. Using multiple methods is very helpful. I focused a lot today on survey research, but the use of focus groups and interviews are also very valuable. And then tracking people over time. I know with Michigan State Extension, we could do a better job of having, you know, if a person goes to this program and then they go to another program, are we tracking that? Do we know the variety of programs? Someone might be a repeat extension audience member. We could do a lot more in, I think, evaluating that. And then knowing what's the right amount of program dosage and the right amount of time to give people to make changes. So having realistic expectations around long-term outcomes is important. And we have found the program logic model a very useful tool for us to help plan that out, because it does provide, 3 levels of outcomes. We tend to tell people in extension to focus on, we should at least be measuring short-term outcomes. And then if you're able, get those intermediate outcomes with follow-up. And then we realize some of the long-term outcomes, those might be many, many years to achieve, or many, many programs working together to achieve. So that completes the information I have. I do see some questions that have been coming through the chat. So come on up to the chat.
Cheryl, I want to make sure that you saw this question from Renee about how to do the retrospective survey with the actual, how to direct your participants, whether they have to do the first column first and then the after, or if it doesn't matter.
Yeah, that's a great question. We get that question a lot because I think you should have good written instructions for the people who like to read it, where it express that the before and the after. And I've seen it in the literature and in extension examples swapped, right-hand side, left-hand side. There's a movement that says, that likes to say the retrospective pre, then post. So, or post, then pre. So you would say, where are you now? Where were you before? Because that's like the retrospective part. But I've also seen people turn that and just say now before. So even the own academic literature in program evaluation is mixed. There's even some people who don't even believe in retrospective designs. And so I just mentioned that because do I think that there's a perfect way? No. But I think that you should stay consistent. You should never flip things, right, in a one survey. Some techniques we have found helpful is to verbally say the instructions, provide the instructions on the form. And in some cases, we'll even say, fold your sheet of paper. And why don't you think about right now and go down the list. And then what did you think before and go down the list. That is one way to do it. It takes a little longer because you're kind of doing a group administered survey together. But I've seen it both ways, or they just go by item. So if anyone else has thoughts on that, I'd be happy to hear. Was there another question too? I think there's another question in the chat about in a retrospective, do the direct learners fill out before? Yeah, that's the same question from Renee. Okay.
Same question, yep. There's one from Tara, but you answered that one earlier.
Okay, great. Is there anyone who's like opposed to retrospective designs? I'd be curious to know that. I know sometimes people have strong feelings about it. We have found them pretty practical and efficient. And there are studies that show how that response bias can be reduced. But I know it takes a little bit of talking through sometimes if people really believe in that traditional pre and post format, and I do think there's a place for that too. It comes down to good record management, having unique identifiers on the pre and post, and especially for those follow-up studies, being able to connect that to pre and post. Sometimes there's a gap there, like you did the follow-up a couple of years later and can't really connect it to their pre and post earlier. So I think in extension, we could do a better job, which is that tracking and monitoring. It gets to be a little more like research instead of program evaluation, but I think there might be some benefit in that as we are pressured to track longer term changes.
Cheryl, this is Kristen. I wonder if it would be possible to provide some of the citations for the studies supporting that retrospective approach.
Yep.
I know if we're looking at this information, being able to back it up and justify it, such a great way to allow more flexibility for the type of approach that you use.
Kristen, it's a great point. And as someone who has published on using a retrospective design, it's a question I get from journal reviewers as well. And so I actually have on the ready in my folder right now 5 different papers that talk about the advantage of retrospective. I'd be happy to share that, and maybe we can put that on the website. I'm not sure how we can get it to the folks here today, but there's Hill and Betts. There's a couple that I should have them ready. There's a couple that are just you know, they were really good studies at the time, even though they might be a 15-year-old citation, they're still used because it demonstrated effectiveness. Yeah. The evaluation replies. Some will not answer at all. Indicate 2 responses when you just ask for 1. So how do you tally? Yeah, we are very adamant with our extension programs that all evaluation is voluntary. So we will have on our forms, all questions and responses are voluntary and confidential. We can't say anonymous because we see you in the room, we know who you are, but they're confidential and they're voluntary. So I often see that issue of people who skip questions. And that's why we use the number assessed figure, because we know, like, if you just had 100 evaluations, but 12 people skipped it, you're going to want to change that number assessed before you create a percent change so that you can incorporate that missing information there. And then I think when you get to multivariate analysis, there's other things you can do to impute or even just list-wise delete people who have too much missing information. So we can handle that differently depending on like how many surveys we have. For the people that love to circle 2 numbers, if it makes sense, if we're going to be using it in a numeric way, we might count that as a 2.5, say we circle between 2 and 3, but more often we just leave them missing because we don't know what they intended to mean. And then we take a closer look at why were they doing that with that question. Maybe the question wasn't mutually exclusive and it was overlapping. Another thing we've done here over the last 8 years is really focus on established scales. So they've already been pilot tested and they have some reliability, validity, and that has helped us sort of reduce the amount of times we see that happen. I think because it's already been through that review stage. That's why you always want to pilot new survey questions, because maybe you think it's clear, but what is the difference between sometimes and often? Like maybe that's not a good question. So that's what we do with that kind of information. We would count it as missing and then take a closer look at that question.
Cheryl, you have another question from Karen in Wisconsin. Do you have any recommendations of how to measure outcomes in collaborative work with other agencies?
Yes. We get this question from our community development people because they'll say, well, it wasn't my program. I just did a part of that talk. And so we dig deeper into that. And when you have collaborations, we think, this is sort of our stance at Michigan State, that we have an opportunity to be that university partner, often around the table of other nonprofits or other even government agencies. And so we've tried to get our staff to step up and say, so what are our mutual goals for this program? Like, I know I'm just one speaker on a topic, but what were your goals for yours? And kind of coordinate that on behalf of a group and then say, you know, we can co-brand this survey. We can get the results back to all parties who taught at that workshop. So I think we've done a little bit of work of getting people to feel confident about that, saying, you know, as we need to evaluate our programs, and I'm going to probably have to do it anyways. What would you like to know? And let me provide that report back to you. And we have found that to be very popular. And not always among some of the extension staff, because they might feel it's something extra, but for the extension staff that have done that and have made it a collaborative, like, let's have shared measurement and get the reports back to each other. As long as we co-brand things and talk about it as a partnership and not just have like the Michigan State logo, like it's our evaluation, we're going to take credit for all these outcomes that other partners are doing. Just being really open and honest about that. Like, we want to show the value of the collective. So I hope that answers your question, Karen. We've had some success there. If you have any tips, let me know. Oh, yeah, the collaborative work is a common question. It's about communication, and I think offering up to serve in that role. So many other nonprofits and government agencies, they might like to know, but they don't have capacity or skills to do that, and so they like it when we take that sort of researcher side and say, well, let us do that for you, because it's important to us too. there's no more questions, I just want to say thank you. Thank you for tuning in on this Friday to learn about and talk about program evaluation. Appreciate your time. Data you measure for collaborative outcomes. A lot, it falls under the area of leadership development because, again, I know these are community development examples, but, you know, Extension might have one piece in that, like they're coming to talk about ordinances or zoning or tourism as the new economy or some sort of piece of a workshop. And so if we take a step back, what I do is as an evaluation specialist, I would challenge the educator saying, well, what was the purpose of the whole day? And why are you guys even doing this with your audience? And they said, oh, well, we want to make better leaders in the community. Okay, there's the concept. How do you want to measure that leadership development? So kind of getting them out of the, what did you think of this speaker and that speaker and this speaker, but to that bigger goal of what did you want them to walk away with, and measuring concepts at that level. So that's how I've seen the collaborations. Sometimes the collaboration evaluation can even be very internal. Like, how did it go with us collaborating on this event together? And so that might take the form of a debrief meeting where you've planned an event, you've had that. Maybe you've collected some information directly from participants, which would be great. But maybe you also collect information at that debrief meeting about how did our collaboration work? What was the what could we do better or different? And that's more of a process evaluation, and that would be more of a maybe even qualitative, like listening, interviewing, taking some notes. But I've seen that with collaborations working together. I've also seen a lot of final reports that are co-branded and then sent to different agencies. So look, we did this program together, and it kind of goes up to administration or up to boards, you know, people who would want to know and see like a report type of outcome. Any other evaluation questions? Kristen, did you want to put our evaluation link in the chat? Because if you'd like to give feedback on today's North Central Region Aging Networks webinar, we would appreciate it, because then we know if these are valuable use of your time and if we should keep offering them. We do have a lot of offerings on our website for 2019. I hope you can look at our upcoming webinars and put a calendar note in to join us for more of them in the new year.
Cheryl, thank you for the reminder. I just put that in. There's also
great.
Another question from Renee. Do you have a resource you can mention regarding measurements for collaboration?
I feel like that's a whole area of discovery. You know, Renee, why don't you put your email in the chat, and I will, in a good extension fashion, I will find you a resource or connect you to someone who knows. So Renee, if you could let me know your email. I will grab that right now. Oh, was that Karen that asked? Maybe. Oh, and there's Renee. Karen also wants the materials, maybe?
Yep, that was Renee initially, and then Karen would also like them, and maybe we can create a link or something on the website with the archived webinar so that other people can access these too if they would like to.
Yeah, especially for the retrospective papers too, because it is helpful just to have like the PDF and not just the reference, you know? Allocating. All right. Thank you, Karen and Renee. All right. Thanks, Kristen.